My name is Dr. Emmanuel, and I'm here to discuss how we diagnose and test for a traumatic brain injury. In another video, we spoke about how we treat it. In this one, we'd like to focus on how exactly we determine the level or degree of traumatic brain injury that a patient might have. We do several things. We'll do a vision test called the right eye exam. Another one, balance testing, or computer dynamic posturography, CDP for short. We also wrap up with a qualitative electroencephalogram, a QEEG, and I'll briefly explain how each of those work. First, we'll start here with the right eye assessment. Essentially, the importance of this is after a concussion, sometimes our vision is affected, and we wouldn't think that. And because it's affected, it can lead to symptoms such as headache or balance issues. So here, we do a brief eye exam just to make sure everything is going okay and vision is unaffected, or if it is, the degree of the affection of the vision of the patient. Now, if you follow me here, I'll introduce you guys to Sammy the Spine. We use this model here to sort of describe the degrees of possible injury to the spine. And again, spinal injuries can occur at any level. From here, the cervical area, down through the thoracic, through the lumbar and the sacral areas. Now here, our balance board, or CDP, as I mentioned earlier. Here we do run a series of testing through this computer here. Okay? What we do is, again, we try and measure the balance of a patient. And in order to do that, we challenge them in different ways. First, we'll ask them to remove their shoes, because our sneakers or shoes, even sandals, provide a degree of balance that assist us, and we don't even realize it. So we ask them to remove their shoes, and we ask them to stand on the plate. We'll ask them to give us their best Superman or Wonder Woman pose, and we'll have them look straight ahead, first with their eyes open, then with their eyes closed, because again, the vision gives us input and sort of lets a brain balance itself out and right itself. After we get a good baseline, we then challenge them with a foam here. We'll put it over here, and we'll do the same thing. Best Superman or Wonder Woman pose. Have them look straight ahead, first with their eyes open, and then with their eyes closed. This way we get very good data and objective data in order to go along with subjective symptoms that the patient might feel. Also do for our traumatic brain injury testing is something called a Creo's cognitive exam. What is it? Well, what this does is allow us to assess cognitive function, and we put it in sort of in a gamified way where patients will go through a series of questions, answering questionnaires, or completing a series of tasks. And the way in which they complete it, if they're able to, gives us a good objective data and a good score in order to go along with any sort of data and subjective symptoms that the patient might feel. We have quite a few things, and we'll test the patients, their traumatic brain injuries, to go along with the treatment modalities that we have here at the BSPI. If you follow me, we'll show you where we do the qualitative electroencephalograms. So as I explained earlier, this here is the EEG room, or the electroencephalogram room. This is where we record our brain data, the brain mapping for the EEG. Typically, we start with these caps. They come in 3 sizes: yellow for pediatric patients, red for adolescent patients, blue for adults. Obviously, it's not a hard rule. People's head shapes and sizes are different. We accommodate them, and these are the ways we accommodate the head sizes. Once we have the cap on, we use some gel, the electro gel, which allows us to pick up the brain waves and form the brain map. Once we have everything there in place, we usually record for about 10 to 15 minutes, and it allows us to get good data, and all the data here is recorded on this laptop. From there, we upload the data to our team in California, and they begin to analyze it, and within 2 to 3 business days, granted, usually we get it sooner. As the saying goes, we like to under-promise and over-deliver.